Welcome to IBDSmart. This app is designed to help you communicate with your healthcare workers regarding the activity of your inflammatory bowel disease, which in your case is Crohn's disease. It has been developed by the Gut Health Network of Otago University with the backing of the New Zealand Society of Gastroenterology. In this video, I will guide you through completion of the Harvey-Bradshaw Index, or HBI, which is an activity index specifically designed for patients with Crohn's disease. Once you log on to IBDSmart, you will get to this window. Here, there is a choice of two tabs to click on. The Harvey-Bradshaw Index tab is designed to be used for routine reporting of your disease activity. For instance, when you are attending a scheduled checkup or reapplying for medications. The red Report a Flare tab also gets you to complete a set of HBI questions and can be used to alert your healthcare worker that you are concerned about your Crohn's at any time. The first thing to note is that you need to learn how to examine your own abdomen or tummy so you can report to us if there are any lumps there. To do this, you need to open the HBI and then scroll down to question 4, labelled Abdominal Mass. This question asks if you have a mass or lump that you can feel. If you click on the little information icon, you will find an explanatory video which guides you through the self-examination. I suggest you find a place where you can lie down on your own and then open this video in private and practice this new skill. Once you are happy with that, then come back to this video guide and proceed from here. We'll catch up in a few minutes. Right, now you're an expert in examining your abdomen, let's take you through how to complete the full Harvey-Bradshaw Index. The HBI is actually an abbreviated form of the Crohn's Disease Activity Index, which many of you will recognise as a 7-day diary-based scoring system. An important difference is that the HBI just relates to how your Crohn's has been in the last 24 hours. The index contains 10 questions and then an area to add any comments of your own. The first question relates to how you felt your Crohn's has affected your general health. It may be that you feel very well, or maybe not quite what you would expect, which would be slightly below par. You might feel poor, very poor, or the worst feeling of terrible. The second question asks if you have any abdominal pain and how bad it was, classified as mild, moderate, or severe. Question 3 relates to the number of times you've had liquid or soft bowel motions in the last 24 hours. The definition of loose is given by clicking on the little information. Here you'll see an outtake of the Bristol Stool Scale. Question 4, which asks about abdominal masses. You need to find that private area where you can lie down and examine your tummy, as described in the video. Decide whether there is anything abnormal, and if you think there might be a lump, how sure you are about it. Dubious if not sure, definite if you are sure, and if it hurts when you press on it, put the tender score down. Fill some numbers in. The next 6 questions are about other specific problems that occur in Crohn's disease, and they can be reported as simply as a yes or no. Question 5 is about whether you've had painful red or swollen joints. Question 6 relates to eye problems. Clicking on the little icon shows you examples of scleritis or uveitis, the most common eye problems we're interested in. Question 7 relates to mouth problems, and again there's illustrations of what we mean by this. Question 8 asks about two types of skin problems. They are both illustrated here. We want to know whether you've had deep, painful, ulcerated areas, or raised, purplish, tender lumps on your shins or arms most commonly. I'll say yes. Perianal problems are troublesome things around your bottom, such as tears, cracks or tender lumps surrounding your anus, and they are very important to tell us about. Question 10 is about a particular problem specific to some types of Crohn's disease. That's the development of abnormal openings onto your skin, most often again around your bottom, which might leak fluid or mucus, and these are called fistula. Lastly, there is a comments box for you to tell us about anything else you think is important. You will see right at the bottom that there is a running total score, and once you are happy you have told us everything we need to know to help you, then you can press Send the Survey. The HBI score will then be emailed to the medical carer that you have already nominated, along with a summary of your previous scores, and you will be taken back to this page, the IBDSmart dashboard. If you're ready to click out, press on the patient info icon, sign out. I hope this has made things easy for you. If it is not clear, simply send a message to your medical team via that comments box. Kia ora.